Hello, everybody, and thank you very much for giving me the opportunity of talking about something very important, which is the climate change and the human health. In this video, I will be shortly talk about the impact of climate change on human health in the world. I will also show you the result of our study in a region of Iran. This is Omid Abu Bakri, assistant professor of epidemiology, working at assistant professor in public health faculty in the Kurdistan University of Medical Sciences, which is located to the west of Iran. So to start with, I want to say the climate change is the biggest health threat, and this is what World Health Organization said in 2019. But why is it the biggest health in the world? Let's talk about it. First of all, the climate change has got several adverse effects on human health, such as the cardiovascular disease, the respiratory disease, and some infectious disease. But how the climate change affect the human health? As you can see, it has the adverse effect through social and environmental determinants, namely the air, the drinking water, the food, and secure shelter. And it is projected that more than 200,000 people will be died of the climate change by 2050. And this is the big concern. And it shows that the climate change is going to be a catastrophe by 2050. As I said again, it has got several adverse effects indirectly, mainly through malnutrition, malaria, diarrhea, heat stress, for example. Uh, Here I brought you the impact of climate change in the world. As you can see, some part of the world, such as United States and some countries in Europe, seem to be safe of the climate change. But here in this map, opposite thing happened. So the question is, which map is right? Which map we can trust it? And I would say none of them actually. Why? The question is why we can't trust the two maps here, and this is what the maps. I would say that honestly, we don't have population based data in the world. Of course, we've got some data in the world, like this one. This is a great study and great map. Actually, I can trust the result of this map. I really trust it because this is individual and multi-country study. But as here again, we don't have the data from several countries. So we are not able to talk about the impact of climate change in the world, but the previous map. So the key point that I'm going to say is that we don't have individual data in all countries. We have got the data from some countries like this, which is the validated result. I think. So totally we need to data set from different countries, individual based data to say and to conclude the impact of climate change in the world. Here in this figure, I brought you the result of our study currently conducted in a region of Iran. In this study, we compared the number of heat waves along their duration between two periods. The first period was 28 to 2014, and the second period was 2015 to 2020. So the number of heat waves, the first column actually, the first column shows the number of heat waves, and this column shows the number of heat waves as well, but in the first period. So as you can see in the first period, the number of heat waves were lower than second period. In other words, in the second period, we have seen several heat waves. For example, in the city named Bane, in the first period, we saw 20 heat waves, but in the second period, it was increased to the 35 heat waves. In some cities like Bijar, uh, there was not only the increase in the number of heat waves but also the increase in the duration of heat waves. For example, here in the first period we saw the heat waves last for 3.9 days on average, but in the second period they last for 5.5 days on average. So here I brought the result of the duration of the difference in the duration of heat waves between the two periods, and in the most cities the duration of heat waves have been increased, except for some cities like Bane, but mostly the duration of heat waves increased. This figure also shows the number and duration of heat waves by different definition, actually with this sensitivity analysis to have a robust result. In this figure, again, I showed you the pooled result of the number of heat waves and their duration. As you can see, again, the number of heat waves have been increased in the second period. The blue one actually for the first period. So the number of heat waves in the first period are lower than second period, and the duration of heat waves have been increased in the second period as well. But the risk of mortality due to the heat waves in second period, depending on the definition of heat wave, was different. Actually, in this figure I brought you the heat waves by different heat definitions. The first one is the weakest heat wave and the last one is the strongest one. The first one in the first period has got lower impact. So in the second period, the weakest heat wave has got higher impact compared to the first period. But in other definition, we saw not significant difference. However, for the stronger heat waves in the second period, they had lower impact, and the reason might be many. The adaptation, the strategies like using the new technology based air conditioner, and several reasons might be behind the lower impact of heat wave in the second period by these definitions. So totally, the weakest heat wave had the higher impact in the second period, but the stronger heat waves had lower impact in the second period. Who are more at risk? I would say no one is safe. No one is safe. However, the people whose health is already at risk uh, and they are actually have lower impact on the climate change. Actually, the main reason behind the climate change is the people, those who are living in high income countries, but uh, the people who are living in low income countries are more at risk. This is amazing, and we have to take attention to this point. So I have to say it again: the people who are living in the low-income countries are more at risk of the health impact of climate change. However, they don't have the any impact on the climate change. They are not the reason of a climate change. Indeed, what we should do to cope with the climate change, how we can cope with the crisis. First of all, the IPCC, the Intergovernmental Panel on Climate Change, says that the world must limit the temperature rise to 1.5 degrees C. And this is the goal of the Paris Agreement. But how can we reach the goal? To reach the goal, there are several strategies. Here I brought you some of them. The transportation system the better transportation system, food and energy use choices, the right choices actually, and the reduce air pollution in atmosphere. They are all a good strategies to reduce the impact of climate change. In addition, we have got some strategies that are newly used by some countries, especially in Europe and Canada and United States. Heat health warning system, or the WHWS, air conditioners, planting trees, local action like risk map and education. They are a very good idea to tackle the uh, impact of climate on health. The air conditioners had already good protective effect. For example, the study in Chicago back in 1995 showed that those who used the air conditioners had lower chance of getting mortality of the heat waves. Let's pull the heat health warning system. The heat health warning system is a system that uses meteorological forecasts to initiate acute public health interventions. This is the definition of WHWS. I should say the intervention can be implemented through media, opening cooling center, home visits, telephone calls to the vulnerable people, and website bulletin. So these are the strategies that are used in the heat health warning system, which has recently applied in many countries. I think it is a good idea to focus on the system in every country. So this is the impact of climate change in the world. So to sum up, I would say that to see the impact of climate change in the world, we need the data, especially the health data. Of course, we have got meteorological data in the world, but we need the health data like mortality, like hospital data in every country. And then we can see the impact of climate change in the world. Otherwise, we can see the low evidence of climate change in each country, which I think it is local based and it is not very valid evidence of impact of climate change. So totally we need data set, especially the health data, and there are several strategies to cope with the climate change. I mentioned some of them in the previous PowerPoint, previous slides. The heat health warning system is one of them, which is really great idea to cope with the climate change, and I highly see that it's very effective indeed. This is it. Thank you for your attention, and I hopefully gave you some new information, and thank you very much.